Hello, good morning. My name is Brianna and I am a student at Mountain View College. And today I'm going to demonstrate how to change out essential line dressing on a patient using a sterile technique for fall 2022. So the first thing I'm going to do is verify my physician's orders. I have Wanda Chi, 2019 XS. She has no known allergies. It looks like the physician has ordered for a central line dressing change every 7 days and PRN. And he would like to be notified if there's any redness, tenderness, swelling, or foul-smelling drainage present. All right, so then I'm going to go ahead and go to the supply room. I'm going to gather my supplies. I'm going to make sure to check the containers for the expiration dates. And then we're going to go ahead and head to the patient's room.
Okay, so I'm assisting for
Privacy. Good morning, Ms. Chi. My name is Brianna. I'm going to be your nurse today. Can you go ahead and verify your name and date of birth for me? Perfect. And do you have any allergies I need to be aware of? No? Okay. Well, the doctor has ordered to have a dressing change down your central line. Do you have any questions before we get started? She says no. Okay. So I'm going to go ahead and bring the bed up.
And I would verify that.
So go ahead and perform hand hygiene. And then the first thing I'm going to do is going to be to inspect the area to make sure that I don't see any drainage, any signs of infection, that there's no pain. Next thing I'm going to do is to measure the size of the port that's coming out. So it's at exactly 15 centimeters, and I go ahead and check my the previous nurse's measurement that she got, and it's also 15 inches, so that's good. That means that the port has not moved out at all. Next thing I would do is go ahead and put a mask on the patient. Ms. Chi, I'm going to have to ask you to go ahead and wear this mask, or you can turn your head to the side. The reason why you have to wear a mask is just to prevent breathing on the site while I change it to prevent infection, okay? And I would put one on as well. So next I'm going to go ahead and remove the patch. Remove the patch by pulling down away from the skin. It helps prevent skin breakdown. And you want to be careful not to touch the site. I'll go ahead and perform hand hygiene. Being careful not to touch the patch, we're going to drop it into our sterile field. Okay. And remember, we already have a mask on our patient. I already had one on too, so we're just gonna toss this. I'm gonna adjust the camera just a little bit so you can see me put on my gloves. Okay, so I have my sterile gloves on. I'm gonna go ahead and stop and move the camera over again.
This would be my dirty. You're seeing some of the line that would be inside the dressing.
And I would go ahead and break this. This is gonna now be my dirty hands. So you're gonna go ahead and stabilize the port while you clean. It's important to scrub in a back and forth motion for at least 30 seconds. Being careful not to tug on the line. Alright, you want to let that dry completely before you go ahead and put on your patch. You want to make sure that you touch your patch with your sterile hand. You want to center your Tegaderm over the site.
And then we can go ahead and use the potassium to remove this. And then add the date, time, and then show the day that the dressing was changed so that the other nurses would know.
Alright, let's see how are you doing.
How are you doing?
She says that she's doing well. So I'm going to go ahead and put the date, the time, and my initials
So I'm gonna go ahead and
And
bring
you wanna
back
put it
in
to
a
the
comfortable
side
position. While I
of the
put that
insertion site so that you can be able to visualize it if you need to. I would go ahead and clean everything up. Go ahead and move the bed back down in the lowest position. Make sure the call light is close by. Let the patient know when I would be back. And then I would document the procedure, what the site looked like, if there was any drainage present, that I did the dressing change per sterile procedure, and when it should be changed again. Thank you for
Are you
watching.
comfortable with this? Okay.